I think the issue with osteoarthritis that we see quite a lot is people will get an osteoarthritis flare up and go into quite a high level of pain, and then they'll completely stop doing any form of exercise whatsoever, which they think is going to make things better, when in fact it actually makes things worse and accelerates the inflammatory processes.
Does arthritis mean you have to have surgery? The answer as a physio is usually no, but it really depends on the individual.
If you have done the exercise leading up to it, particularly getting strong in those muscle groups we spoke about earlier, you'll find your recovery is much, much, much faster. And nearly every orthopedic surgeon you talk to will say the exact same thing. Generally, I would say get a good 3 to 6 months of strength training work done before you consider surgery.
Hi, everyone, and welcome to the show that helps you become more confident in your body so you can keep doing the things that you love. My name is Michael Demansky. I'm the Senior Physiotherapist at MD Health, and I'm joined by another Senior Physiotherapist at MD Health, Will Ryan. He's been on the show before, and welcome back. It's great to have a good conversation with you about some really important issues that we see here on a daily basis at the clinic.
Yeah, it's great to be back, and I think this is a really important topic to let all the listeners know a bit more about, and in a bit more depth too.
Well, let's talk about this one. Arthritis doesn't mean you have to have surgery. We see people with knee, hip, back arthritis on a daily basis as well. I want to go back to a fundamental question today. We're going to talk about a bit more about arthritis and what the options are with that too, because it's not a dead end as well. So let's start talking about that as a definition. From what you understand, we'll talk about specifically about osteoarthritis. There are many different types as well. There's inflammatory ones like rheumatoid arthritis and so forth. We're more specifically talking about osteoarthritis, which is that change in the cartilage. That's the most common type that we see. From your perspective, Will, what is osteoarthritis or arthritis, and how is it both a mechanical problem and an inflammatory problem? Because it's not just wear and tear, is it?
No, not at all. So I think what a lot of people's understanding of osteoarthritis is that it's really just a wear and tear down of the articular cartilage in a joint. So the cartilage wears down, thins out, and then the bones start, I guess, rubbing against each other. That's not necessarily the case. It can be the case in some people, but the way we should look at osteoarthritis is as a whole joint issue. So quite often with osteoarthritis, if we talk about the knee, for example, it's not just the articular cartilage being involved. It's the synovial fluid, so the fluid that helps lubricate our joints, that gets involved. The meniscus can often be involved as well, in the knees in particular. A lot of other things like bone spurs and things like that are really common in an osteoarthritic joint as well. So quite often it's not just the cartilage being affected, it's the whole joint itself and all those little structures within the joint. I guess the articular cartilage decay is part of the mechanical problem within the joint, but the inflammatory processes that happen with osteoarthritis are the primary drivers of pain. Articular cartilage doesn't actually have a great nerve supply. So just the lack of presence of articular cartilage won't equal pain. The biggest driver of pain in most osteoarthritic joints is swelling and inflammation within the synovial fluid itself. So that's called synovitis, and that's probably the biggest thing in terms of pain that us as physios help people with in terms of controlling that.
All right, let's go back a step with that one too, because not everyone knows what articular cartilage is. Not everyone knows what a synovial fluid, or synovium is, and how are those related? What are those things as well?
So the articular cartilage is a bunch of cells called chondrocytes, and there's other things involved with those cells as well that cover the ends of our bone. So they allow for good gliding movements of our bones on one another. The synovial fluid sits in between those two ends of the bone within every joint of our body. And like I said, that kind of acts more as a lubrication, helps reduce friction within the joint, helps the joints move nicely. They coexist, but they do play off each other quite a bit when it comes to osteoarthritis.
So with the articular cartilage as well, it's this white stuff. So it looks white, but that's the normal color of it too. It's a spongy, so to some degree it compresses, and so it can take loads, made to take take load then, as Will said as well, it doesn't have a nerve supply, so you can't actually feel it. And so it's made to compress and take load, and you don't feel that part as well. And that's the way our joints are normally designed. So as it thins, it becomes weaker, you won't necessarily feel that process. But what happens is that around the sides of the joint, the one cell layer thin tissue called synovium, and it's there to nourish the joint. In between each of the joints is this synovial fluid. Our joints don't have a direct blood supply. It doesn't get nutrients from blood coming in and out. It gets it from the bits around it. So the synovium has a blood supply to it too. Fluid goes from the blood supply in the synovium into the joint and back and forward. And as we move around, that stuff moves around and provides nutrients to this cartilage layer. It's a normal part of it too. Now, as opposed to the cartilage, the synovium has a very rich nerve supply and a very rich blood supply. And so you can feel that. And so when you get wear and tear, bits of cartilage, bits of break off, and they float around in the joint as well. And your body will break it down to some degree and so forth. But as that stuff happens, it starts to lodge in the synovial area and it causes an inflammatory response. And that's where a lot of the pain comes from. It's not the cartilage itself, it's the bits of cartilage that break off over time, cause debris, they cause an inflammatory response in the bits around it. That's where a lot of the pain comes from, the arthritis.
Yep, spot on.
Yeah. And so this is why it's both a mechanical problem and an inflammatory problem. It's not just the wear and tear that will happen, but in itself, that doesn't always. People can have awful arthritis in the knees and not feel a thing. But people can have very mild arthritis in the knees and have a lot of pain. It depends on the degree, the inflammation, irritation of the lining of the joint that actually gives people most of the symptoms.
Yeah, that's exactly right.
Yeah. And so managing that process is super important. And just because you have it cleaned out doesn't mean those bits of cartilage aren't going to be there. Like they'll still be there. So that's, we know that having a knee arthroscope to clean out the knee for arthritis just doesn't work. It doesn't do anything. It won't make it better. It won't fix it. It won't slow the process down. So managing that inflammatory part of it too is super important.
Yeah.
So the big one is like, I know where our opinion is a bit biased, but is exercise safe? And am I going to do more damage by doing exercise for arthritis, both knee, hip, back, whatever area?
Yeah, I guess when we talk about exercise with osteoarthritis, it's very much what can we tolerate and what levels are safe to do. Exercise is safe to do to a certain point. So you wouldn't go out and go past, like push through the pain quite a lot, because you can actually cause more damage doing that, but you can exercise to a degree. Look, one of the guides we tend to kind of use is an out of 10 pain scale. So we can exercise up to a 4 or a 5 out of 10 safely, not past that. That's probably one of the easiest tools we use when we're working with our clients. But exercise is really beneficial for an osteoarthritic knee. It can help the cartilage cells regenerate. It attracts water to the joint, which mitigates that inflammatory response that we were talking about, which is the pain, main pain driver. So exercise to tolerable amounts is super, super important with osteoarthritis for sure.
Yeah. And so the big deal about that is what we were saying as well, is that the cartilages, particularly the articular cartilage that is the lining of the joint, needs load. It needs load to know how to do. So chondrocytes, which are the main cells of articular cartilage, need load in order to be able to then do their job properly as well. That's how they respond and react well. If you don't load those joints appropriately, they're going to die away. They're built for load, so they need that degree of nourishment and that degree of stress to be able to do their job properly as well. And the other big thing as well, because there's no blood supply into the joint as well, if we don't move the joints, that stuff sticks around. It doesn't get nourished. It doesn't allow the synovial fluid to move around. Doesn't allow that to wash away. So the way it actually gets nourishment and gets blood supply from the surrounding areas is by movement in the area. If we don't move the area, that's why if you do have arthritis or early arthritis and it feels so stiff after you've been moving, because that synovial fluid hasn't moved. And the inflammatory chemicals that are built up are in one spot, and if you feel them, when you move around, it moves that around. So it's a really important part of management, both for the synovial fluid and the fact that these joints need load.
Yeah, I think that's super important. And I think the issue with osteoarthritis that we see quite a lot is people get an osteoarthritis flare up and go into quite a high level of pain, and then they'll completely stop doing any
Yep.
form of exercise whatsoever, which they think is going to make things better, when in fact it actually makes things worse and accelerates the inflammatory processes. So despite pain being there, it is still quite important to do exercise to some degree to help those processes out.
Well, let's go into what you just said a minute ago. I'll go into a bit more detail about that too. So I have to exercise. I'm going to exercise. What should I do? What are the most important factors? And how do you know it's too much, too little? What is a recommended structure that you would talk about for someone's got arthritis in any body part?
Look, the biggest thing, which actually has been shown up in the research quite a lot, is muscle strength around those joints. So if we talk about the knees, the most important muscle to work on around the knees would be our quadriceps muscle. If we talk about our hips, it would be those muscles in our glutes and on the sides of our hips that are really important at helping. I guess it helps disperse the load across the joint a lot better. So we're
Yeah.
not overloading the joint itself. The muscles take more of the load. And it means we're moving the joint in really good, tolerable ways. But I think before we do any exercise program, it's really important to get looked over thoroughly by a professional, because they should be able to tell you at that point what you can and can't tolerate and work with you to figure that out. Like I said, when we do exercise with osteoarthritis, it needs to be done at a safe level, so we're not getting constant flare-ups. I think it's really important to find out what you can tolerate and then work in that. And then over time, that gets better and better and better.
Yeah. So what I hear from you as well is if you do good exercise, one of the most important part of the strength training, focus on the major support muscles around the area too. So around
Yep.
the knees, the quadriceps, around the hips, the glute muscles as well, because they're the ones that should take most of the load. And so if they're not strong, the joints take more of the load. As those support muscles get stronger, they take more of the load. They help reduce the load onto the joints as well. So that helps that balancing act. Second of all, as well, is that by exercising the area too, you provide the stimulus for the cells within the joint to actually be nourished and actually respond and get stronger as well. So there's two positive sides to that too. The third part is at the level of exercise as well. The pain level is a real guide of how much is enough or too little as well. A degree of pain is normal. We're not doing more damage to it too, but up to about a 4 or 5 out of 10 is the sweet spot. Above that, we're starting to injure it. We're increasing the inflammatory process. Below that, we're nourishing it, and it's a positive process as well. So that finding that right balancing act is really the key for exercising osteoarthritis. It's not everything. It's not nothing. It's that in between spot to know where your body can tolerate it, and it's nourishing the area and not too much that it's irritating it too. And that's where the role of health professional comes into it too. Like the physio, exercise physiologist, our jobs is to make sure that you pick the right sweet spot, that you're improving the health of the area without making it worse. Is that right, Rob?
Yeah, that's exactly right, Mike.
Yeah. Okay. So next one as well is that so people decide to do strength work, they're doing it. How often should they be doing strength work, by the way?
Well, at a minimum, it should be twice a week.
Yeah.
I personally would say for people with osteoarthritis, you'd be looking at more 3 times a week,
Yeah.
with a day or two in between to allow for the muscles to recover and pain levels to dissipate if that's a factor. But yeah, I would say at a minimum twice a week. I think that's super important. And we know the reasons behind that. To actually, get the benefit out of exercise, we need that stimulus at least twice a week. And like I said, for osteoarthritis, I think 3 times a week is actually ideal.
Okay. So exercising 2, 3 times a week, doing strength work as well. What else should they be doing? I mean, is there anything else around that too? We're talking about the strength work. What else is a great thing to do to manage this as well?
I think it's really important talking to another, whether it's your doctor or a dietitian or a nutritionist, about weight management. Weight management is a critical part of all osteoarthritic management. The less pressure we have going through those joints, the better they begin to feel, and the easier it gets to do the exercise as well. So they kind of, again, play off each other. Talking to a professional like a dietitian or a nutritionist as well, they can actually give you advice on anti-inflammatory foods and anti-inflammatory diets as well, which will
Yeah.
help the whole thing. And like I said, if that's under control, then the exercise becomes easier, and all in all, you get a really good positive response. I think that's super critical as well.
Yeah. Yep. That's really important as well. Absolutely as well. So, I mean, I think we talked about when we talked to Tracy Davis, who's a nutritionist as well, she said, for every kilogram in reduction in load on the cartilages, there's a 4-time reduction in load on the area too. So it's not a one-to-one relationship. It's actually a larger relationship than that too. And doing things to reduce the inflammation as well. So that as you're carrying more weight, your general state of inflammation is higher. So that has a direct effect on the joints, not just the mechanical load, but the inflammatory effect on it too. It's a really big deal. What about pain management strategies as well? So Panadol, anti-inflammatories, where do they fit into the picture?
Yeah, so it's a tricky one to work with because some, I guess, analgesics work well for some people and some they don't. So it's definitely a conversation to have more with your GP. They're the professionals on this type of thing. Generally, they should be looked at as like a second line treatment, pharmaceutical relief, and should only be used in conjunction with exercise weight management. If you're just taking painkillers and expecting to get better, you definitely won't. Look, they do have a role to play because it can help us mitigate the pain, help us exercise better, all that sort of thing, which again has a positive effect. But if you're just taking them in isolation, they won't work.
But there is nothing wrong with taking pain medications if we wouldn't conjunct with exercise. So if you need to take Panadol before you exercise as well to help you manage the irritation as well, or afterwards as well. So both anti-inflammatories and Panadol can work really well to manage the pain. It's not going to fix it, as you said, but it helps the process as well. So there's nothing wrong with taking those medications to help manage the pain as well, so you can get on with your life as well. It's not there to mask it, there's to manage it better, so you can do the things that you need to do in a more sustained manner. But being very specific about the load is super important. As we said, we don't want to exercise into heavy pain. We want to have a small degree of pain that settles down, that we know we're working at the right levels.
Yeah, that's exactly right. Yeah.
What about, can I run? Can I cycle? Are those things okay if I want to do those things as well? And I've got arthritis in my hips and knees.
Yeah, those things are completely fine to do. Again, you've got to let pain kind of be your guide a little bit. Running is quite a lot of load through the joint. It can be up to 4 times normal body weight per leg when you are running through each joint. So if that's not tolerable, then I would recommend something a bit gentler like cycling. I think cycling's a great exercise for osteoarthritis. So yeah, I think cycling in particular is a really good one to do. Running is something you'll just have to be a little more careful with, but it still has a good positive effect on the health of the cartilage, on the health of the joint as well. You've just got to be smart with it in terms of your pain levels.
So again, using that guide of, I can run, I've got 3 or 4 out of 10 pain in terms of hip joint pain when I'm running, but when I stop, it settles down. If I run 5 kilometers, I'm okay. If I run 10, then I really flare up as well. Your body's giving you a guide of where you're at. There's nothing, that doesn't mean you can't do that too. It just means you have to really manage the load management as well. So just a reminder to the listeners as well, I'm talking to Will Ryan, as one of our senior physiotherapists in Be Health as well. We're talking about a very important topic about what does arthritis mean you have to have surgery. The answer as a physio is usually no, but it's usually not no forever. It might be no for now, but maybe later, but maybe not later as well. It really depends on the individual. Because we talked about, really important as well, that arthritis is not just a mechanical problem, it's both a mechanical and inflammatory problem, and the inflammatory part is probably a really major part of it. So managing the inflammatory part of it is super important. Strength training is a key, 2 to 3 times a week, ideally 3 times a week for arthritis, and other aspects that are important as well, both nutrition, making sure your weight's managed as well, because that affects the loads on the cartilages, and also that inflammatory process, and then the appropriate times for taking analgesic medications such as Panadol, anti-inflammatories as well. They all have a role to help manage the process, and they're not, or they're often all and things to work on as well. So when is it time for surgery, and what type of surgery should people have? So should they get a clean out of their hip joint or their knee joint? Should they get a hip or knee replacement? When, what are the operations, and when should they be done?
I would say, look, the most successful operations for osteoarthritis are total joint replacements. It's quite a big surgery. So ideally you put it off as long as possible, or you can, we've worked with people who haven't who've come in, who have expected this to be their final outcome, and they've never had to actually have the surgery. So look, total joint replacements, they do work really well. They work even better if you have done the exercise leading up to it, particularly getting strong in those muscle groups we spoke about earlier. You'll find your recovery is much, much, much faster. And nearly every orthopedic surgeon you talk to will say the exact same thing. Generally, I would say get a good 3 to 6 months of strength training work done before you consider surgery anyway. It's cheaper, it's safer. You might find your symptoms improve and you don't have to go down the surgical route. That's the general advice I give to most people who suffer from this. Yeah.
Yeah, it's a really big deal. I mean, everything you said, well, I've seen it for 20 years as well, is that people, if they're considering surgery as well, it's not the last straw. It's a part of the process. And so if you've done a good 3 months of strength work as well, and you're still really not changed, the big deal is that with arthritis as well, is it affecting your life that you can't do the things that you want? That's a real tipping point to have that think about the conversation. And then have I done enough strength work for the last 3 months that actually shows whether that's going to make a difference or not? So if you've done 3 months of strength work, good quality strength work for three, not, oh, I did strength work. Oh, how did you do it? Well, I went a session here, a session there. I did one there. That doesn't count. We're talking about 3 months of 3 times a week structured exercise as well to make the area stronger. We're down the track 3, 6 months. I'm like, you know what? I can't do the things I love. I can't run. I can't, it's really affecting the ability to drive as well. Then it's worth having a conversation, and then any opinion, is it time to have a hip or a knee replacement as well? And then if you've done that work, the outcomes are so different, so, so different. We've seen so many people where they've done the 3 months of strength work beforehand. It's not always, but they're out of hospital 3 or 4 days, depending on the operation. The outcome is great. 6 weeks later, we can barely tell they've had an operation done. Where if they haven't done the work, it's such a hard slog. It takes years, can often take years to recover. We've seen people a couple of years down the track where they haven't done the rehab work beforehand, and we're doing the work 2 years later that should have been done 2 years prior. And that even though they had the joint replacement as well. So we're just not seeing the outcomes we should see if they haven't done the work. It's not the surgery and that's it. There's the bits that go around that make the difference between a great outcome and a really average outcome. There's a very interesting study that was done in the US, and they looked at people who had knee replacements done. And the reason why they had knee replacement done was for pain. And the theory was that the pain stopped them from doing things. So if they have a joint replacement done, that the pain would go away so they can do more things. 2 years down the track, most of those people had no better life than they had before the operation. They may not have done it all. So what they could do beforehand was exactly the same as what they did afterwards. There was no better outcome in their life. If they do the work, the 3 months of strength work beforehand, the outcome is very, very different. You actually get what you want out of the operation as well, that better life that you have. So, joint replacements are going to last these days anywhere between 20 years to 30 years. These are the ones that were put in 20, 30 years ago. I think roughly now I'm seeing about 25 years is a rough time frame for a joint replacement. So if you're sitting in your 60s and 70s, you're thinking, oh, it's affecting my life. I can't do all the things I want as well. Well, this is going to last another 25 years. And that's the ones they put in 25 years ago. And the materials now are better than they were 25 years ago. So it's going to last a lot of people the rest of their life. So if that's what's stopping you, like, oh, it's a last straw, how long do I delay it? Well, when is it starting to really affect your life? How old am I now? And what's it going to mean if I have it now done now? How much longevity are you going to have? So I'm 65 now. If I have it done now, it's going to last me until I'm 90. Maybe it's a good idea because you want to have a better life. I've done the work. Only if you've done the work that the outcome's going to be great.
Yeah, I agree with that for sure. I think, the work pre-op, post-op are just as important as each other.
Yeah, absolutely. I guess we've talked about it in this now too, but a lot of people think, oh, surgery is the last straw, and if they have the last straw, it's going to fix it. I know we talked about it a minute ago as well, but it's not. You and I know it's not going to fix it. It's part of the journey.
Yeah. Yeah, I think surgery and rehab and pre-op rehab should be seen as a whole one entity, really. Yeah, I think it's all part and parcel of the actual recovery for this issue, whereas one in isolation, often like just surgery. It fixes the mechanical phase, but not all the other stuff we've spoken about today. So, the putting the work in pre and post op is super, super important.
Yeah, and the reason why people have joint replacements done is to get a better life. It's to do the things that you want to do that's affecting you, that you stopped you from having the life that you want. It's not the final straw. It is a part of the journey for you to have a better life. Otherwise, there's actually no point to have the operation done. If it's not going to give you a better life, well, why are you doing it?
Mm.
It's to give you the life that you want that's been restricted. And if you do the work beforehand, that's giving you the best chance of that happening as well. Otherwise, it's just a hard slog. It ain't going to get you the result you want. And you wonder why you did the operation in the first place. And we've seen both examples many, many times. In fact, we've often seen it with the same people where the first time around they didn't have the operation, didn't have the work, and it was such a long recovery. Second time around, and often they've been very scared to the second side. And because they've done the work the second time around, it's a completely different experience.
Yeah.
A lot faster recovery, a lot shorter time in hospital as well, and a much better long-term outcome as well, which is what we really, want to see. And when, as physios, we're not afraid to tell people, it's time to have a conversation about a joint replacement because I can see it affecting your life significantly. We want you to have a better life. It's now time to have that next step, or you're not ready for it. There's a lot more work that you need to put in before you're ready for that.
Yeah. Yeah, I think that's exactly right.
Any other final comments before we finish up that, Bob?
Oh, I don't think so. I just think the key takeaways we spoke about before, exercise is beneficial and safe if it's done correctly and done well. Strength training should be the biggest focus around the exercise program. Anti-inflammatories and analgesics like Panadol can help, but they should be taken in conjunction with exercise and weight management processes. And then surgery can help as well, but you have to put the work in pre and post. Yeah.
And that one, usually discussion, I think we spoke to Surgeon Andrew here as well. He said the same thing as well, that it's not come to surgeon, yeah, we'll operate. It's a discussion. When is the right time for you? And it's a collaborative choice between the patient, the surgeon, the doctor, allied health professional, physio. It's a conversation together. It's like, when is the right time for that individual as well? Not you have pain, you have this much wear and tear, this is the time. It's not. It's a choice. At the right time for the right person in the right place. Well, thank you very much for your time. I think there's some wonderful information as well. And I hope it gives some real practicality to how to manage arthritis. That it's not on, off. It's not, it's a spectrum. It's where it's at for you, how you manage it, and when you make the choices that you do, that are going to give you the best life outcome.
Yeah, that's exactly right. Again, thanks for having me today.
Great. Thank you very much.